Hello all, this is Jess, and I am making a couple YouTubes about infection and about HIV. And then just so that you're aware, at the end of the PowerPoint, starting on slide 22, there is a case study to help you process the information in the PowerPoints, just to be able to give you something to interact with while you're putting together your study materials. So let me share my screen so that I can talk to you about what's going on. There we are. Okay. So the entirety of today's talk is contained in chapter 14. Yay. And so this is a small graphic of the chain of infection. So the chain of infection is the same for every infection out there. We have an agent, it needs to go to a reservoir, it needs to get out of the reservoir through a mode of transmission and into a new reservoir, which is a susceptible host. And it just kind of keeps going through this cycle of replication, I think is a positive word for it. So let's talk about specifically rather than like all sorts of little individual infections, because we talk about different infections throughout different weeks this semester anyway. So let's talk about healthcare acquired infections. So the mode of how people get sick rather than what people are getting sick with. So a healthcare acquired infection is caused by an exposure to an agent in a healthcare setting. So it could be a hospital, it could be assisted living, ambulatory care, long-term care, swing bed unit. But if they are in a healthcare setting and they get sick with an infection, it's a hospital acquired or a healthcare acquired infection. So some different means of entry, urinary catheters, super duper common. And I know you talked about those in Term 1 Skills Lab and Term 1 Skills classes. Central lines, those either the central lines in the subclavian, the IJ, the PICC lines, the ports, or femoral lines. More on those probably in Term 3 high acuity, but central lines are very common, as well as surgical sites. Surgical sites we've talked about. So much of our postoperative care is about surgical site management and keeping infections out of there. And mechanical ventilation. So if we have somebody who is super sick or super traumatized and unable to do their airway and breathing on their own, we will insert an artificial airway. We will put them on artificial breathing. That is known as mechanical ventilation. The other reason why people get healthcare acquired infections is because their immune system is damaged or in overdrive or stressed, and it's not going to be responding appropriately. So if in the case of a surgery, we're having people like purposefully get trauma. That's what surgery is. It's purposeful, intentional, therapeutic trauma. And so that stresses out the immune system already. Plus then if we throw a couple of buggies in there, whether they be viruses or bacteria or fungus, you have a problem, a double big problem, because the immune system is focusing on trying to heal the surgery site and not really looking for bugs. And then all of a sudden now there's bugs and the bugs are like, eh. As well as people can be immunocompromised from either patho reasons or medications. So one of the things that I'm going to be recording today for you is a talk about HIV, which is a pathology-related infection abnormality. And not only does the person acquire this infection, but then that infection kills off their immune system, so then they can't fight off any other problems as well. And then there's also inflammation response medications. This is Thursday. Yesterday, I finished talking to you about endocrine stuffs. And when we were talking about endocrine stuffs, We were also talking about a particular set of hormones that did some particular inflammation immunity responsey stuffs. So think about those. Coming up, preview, spoiler alert, I'm not sure, is we'll be talking about cancer in the near future. And cancer, one of cancer's main treatments is chemotherapy. Chemotherapy's main job is to take out rapidly dividing cells. The cells that are responsible for your immune system are rapidly dividing cells because they need to be booted up real darn quick when there's something in, and they need to be replaced real darn quick because they get wore out really fast in that infection fighting process. So chemotherapy can knock out the immune system by knocking out those rapidly dividing cells in an effort to also kill the cancer. Unhappy side effect. And then there is a way that all of us will be more susceptible to infection. I will get there sooner than you, most likely. Give you a minute to think about that. All of us will become more susceptible to infection as we age. Perhaps you're learning about some sorts of things like this in older adults. I've never taught that class, so I'm not 100% sure how it goes. But as we age, we all lose some infection and immune response to infectious agents. That's why people who are over the age of 65 are encouraged to get a 4th dose, if not a 5th dose of the COVID vaccine. Also super susceptible to infection are the super young. So like the little tiny kids in NICU and peds. We want to keep them as healthy as possible. So like in those first few months, we try and give the infant as much chance to be removed from infection as possible. But that is the way all of us, the times that all of us are more susceptible to infection, regardless of who we are. So there are some different healthcare-associated infection prevention methods. First of all, there's standard precautions. Standard precautions are for all patients, regardless of diagnosis or presumed infection status. And they include hand washing or hand hygiene. So that's why you see SANI all over the place, whether it be ambulatory care, all of the different phases of care. There's hand sanitizer everywhere because that is a universal precaution so that we don't accidentally become the vector. All of these prevention methods that you see here in this table are so that we don't become the vector reservoir. We are not necessarily, like, we as healthcare agents, like we as nurses, CNAs, nursing students, nursing instructors, so that we don't accidentally travel bugs to other people. So in addition to standard precautions is like the main flavor. That is like, if this was ice cream, this standard precautions are vanilla. And then all of the rest of it is gravy and not maybe gravy and ice cream, bad. Oreo cookies or chocolate syrup or caramel or strawberries or however it is that you take your ice cream. So there are different transmission-based precautions, and it's based on how the bug moves. So there's airborne, there's droplet, and then there's contact precautions. So airborne is used for infections that are for small particles that hang out in the air, like chickenpox, otherwise known as varicella. Measles does this, and TB. They can float forever. They live in the air and they are just happy to float in the breeze like a dandelion seed. They just keep going and going and going. Droplet precautions are for infections that spread using droplets from coughing or talking or sneezing. Influenza, COVID, bacterial meningitis, all float. They need a little bit of a droplet to travel. They can't travel independently. These people need a little bit of help. So these bugs use a droplet, whether it be from aerosolizing procedures, talking, what have yous. Then there's also contact precautions, and contact precautions are used for infections from skin to skin contact, or like skin to surface to skin contact. So like C. diff, MRSA, VRE can live on stuff for a little while. So like unwashed hand touches this screen, and then all of a sudden it hasn't been cleaned up, and I touch it with my other hand. Now both hands are infected. Gross. But that's why these the equipment is cleaned a ton. MRSA is out there. It just is. So we have lots of different sterile processing and cleaning techniques that we use to be able to help minimize the spread of the MRSA, the C. diff, and the VRE. So when we're talking to our clients about healthcare acquired infections, here's what we are going to be educating them on. Only take antibiotics prescribed for you. Wash your hands frequently. Follow directions when taking antibiotics. Do not request an antibiotic for a flu or for a cold. That's a virus. Antibiotic is for bacteria. Antiviral is for viruses like flus, colds, and COVID. Finish your antibiotic. And don't save and take leftover antibiotics. So finishing your antibiotic, if we had known then what we know now, and people had finished their antibiotics according to prescription courses, VRE and MRSA wouldn't exist. Well, they probably would, but it would have taken a lot longer for them to get here. The whole reason that methicillin resistant Staphylococcus aureus, MRSA, or vancomycin resistant Enterococcus, VRE, whole reason they exist is because at some point in time, people didn't finish their antibiotic all the way through, and the germs that were left over figured out how to evade either methicillin or vancomycin, and taught it to all their friends and passed on that information. So finishing our antibiotics are super duper important. I'm going to stop sharing here, and I'm going to continue on with another video about human immunodeficiency virus.